Today, as we talk about Alzheimer's disease, it's important for you to understand a little bit about the history of the disease. First diagnosed in 1906-1907 by Dr. Alois Alzheimer, a German neuropathologist, Dr. Alzheimer observed dementia in a woman who presented to his hospital. Her name was Auguste, and as Auguste was reported to his hospital, she had problems with memory and remembering things. People would ask her questions, and she would answer nonsensically or in ways that they couldn't understand. After she passed away, Dr. Alzheimer performed an examination of her brain, and he found what we now consider to be the hallmarks of Alzheimer's disease.
The brain is the most complicated device we've found in the universe. It has 10 billion cells just in the cortex, which is the outer part, and in a single tiny piece of cortex, a cubic millimeter, you have more connections than you have stars in the Milky Way galaxy.
The brain waves.
Analyzing that very carefully.
If we fail to cure or prevent Alzheimer's disease in the years and decades to come, we will be facing an enormous increase in the human suffering as well as the financial and societal impact that will occur.
Right now, Alzheimer's disease is a clinical diagnosis. What that means is that it requires an interview with a patient as well as what we call a knowledgeable informant, typically a friend or close family member. It requires a careful neurologic exam and some amount also of cognitive testing. And it's a clinical diagnosis. A person has to have symptoms. There has to be something wrong. More and more as we understand the biology of Alzheimer's disease, we'd like to make that diagnosis as early as possible. Ideally when there are only very minor symptoms and perhaps even before there are any symptoms. When the disease is present in the brain but hasn't yet manifested itself with problems with memory that interfere with your ability to manage your checkbook. So the future of the disease, with research that's going on right now, is to try and identify biological markers that indicate the presence of the disease either very early in its course when someone's having just mild memory problems, or even perhaps before there are any cognitive problems. And the more we understand those biological markers, the more we can also develop treatments that attack those biological markers and slow the progression of the disease. This is something that's a very promising future. It's real, but it's going to take research to do this. The kind of studies to develop biomarkers and measure how they change over time and to study whether treatments actually slow the course of disease are studies that require large numbers of people followed over a long period of time. And that requires people taking the, if you will, commitment or sacrifice to volunteer in research.
The pictures we get of the brain right now, though there are several really amazing technologies, they're pretty gross. They're at a large level. Now people are saying, wow, it would be really good if we could get a more granular, more fine-grained, deeper images of the brain, so at the molecular level. And I think that's the next frontier for brain imaging.
The history of modern medicine is really tracked back to around 500 years ago, when people decided that it might be a good idea to crack open the body and actually see where the disease is. If someone is bilious, is his liver really affected? If someone is demented, is his brain affected? And it's not that long ago, but that really gave rise to this idea that we actually have to see the disease to understand it. Alois Alzheimer's was a German neuropathologist. His use of novel staining techniques in dead brain under the microscope allowed him for the first time to see this constellation of amyloid plaques, neurofibrillary tangles, and it ultimately justified calling this disease Alzheimer's disease.